The unknown history of health insurance and why it is so expensive. Health insurance has been around for a long time. In fact, did you know the first health insurance policy was written in 1748 by Benjamin Franklin? It started with the first hospitals and began with a handful of small-scale programs that were built by religious organizations in order to care for people who couldn't afford their own medical care, and were founded by donations from members, affluent citizens, and local businesses. In 1873, there were only about 50 hospitals in America, and many of them were not equipped with modern facilities or amenities. The first health insurance company was founded in 1882 by Aetna Life Insurance Company in Hartford, Connecticut. It provided coverage for individuals who had been injured at work or suffering from illness or disease. In 1883, the American Medicine Association, or AMA, published a report that criticized these early insurance plans because they didn't provide adequate coverage or protection against fraud or abuse by doctors or hospitals. The AMA urged state governments to create laws regulating these organizations so they could protect patients from unscrupulous providers who might try to take advantage of them financially or medically while they were under treatment at hospitals or clinics operated by these organizations. Remember this term, unintentional consequences. The first time that the hospital was built specifically for patients with mental illness was in 1890 at Elgin State Hospital in Illinois. This facility opened its doors on June 1st of that year, providing treatment for people suffering of schizophrenia and other forms of mental illness, as well as tuberculosis, or TB. By the 1900s, there were more than 150 different types of health insurance plans available in America. However, most people relied on their employers for coverage since this type of plan was considered part of an employee benefit program. In 1909, the first group medical practice was founded by two doctors in Des Moines, Iowa, called the Des Moines Medical Society. It was designed to give members access to discounted services at participating hospitals and clinics throughout the state. This was one of the first examples of what we now know as health maintenance organizations, or HMOs. From 1910 through 1920, life insurance companies began offering accident policies as part of their standard offerings. These policies covered costs associated with injuries sustained during accidents while working or traveling on business. However, they did not cover illness or mental disorders caused by accidents outside of work hours. Did you know in 1920 there were no federal laws governing health insurance coverage? Instead, there were many different state laws regulating how much coverage could be provided within different types of policies offered by each different company within that specific state's border. This is still the case today, creating 50 different state regulatory agencies, a major factor which contributes to increased pricing. I bet you didn't know this. Unintentional consequences again. The health insurance industry grew significantly during World War II. During the war, employers began offering health insurance to their workers as part of their benefit package to compete with military enlistment. President Roosevelt prevented companies from increasing wages that were competing with recruitment into armed forces. Because President Roosevelt handicapped these businesses, they then created new no-cost health insurance plans for the workers to entice them from enlisting in the military. We're getting into the juicy part now. Please like, subscribe, and share with your friends these unknown secrets of why health insurance is so expensive. In 1965, President Lyndon Johnson signed the Medicare and Medicaid into law. It was a major part of his Great Society agenda. However, the agenda was not without its critics. Many people believe that the Great Society agenda would lead to the government taking over healthcare, and they were not wrong. Keep listening and you'll see why. Medicare and Medicaid have been a major part of the government's healthcare spending for decades. As we look to the future, it's important to understand the bureaucratic laws that make this unsustainable and providing unintentional consequences. The more government control with healthcare means the more expensive and ineffective healthcare programs become. Enacted in 1996, the Health Insurance Portability and Accountability Act, or HIPAA, is a set of standards that protect from patients' medical records and other personal health information from being disclosed without the patient's permission. HIPAA has been criticized for being slow to adapt to new technologies and for not being stringent enough in its enforcement. Despite these criticisms, HIPAA has been somewhat successful in protecting patient privacy. However, the unintentional consequences created extreme costs to medical providers and health insurance carriers, which in turn raised the cost to the consumer. HIPAA is the reason there are $50 aspirins and $5,000 MRIs. Higher costs were needed to offset the cost every hospital had to absorb in the creation of private rooms for patients, as opposed to the former larger hospital ward rooms or hospital rooms with dual roommates. If your roommate overheard your doctor talking about your medical situation, that was a violation of HIPAA. These HIPAA standards are enforced by the U.S. Department of Health and Human Services. The Affordable Care Act, enacted in 2010, was a landmark piece of legislation that aimed to provide health care to all Americans and fix the high cost that HIPAA created. The ACA has been a source of political gridlock ever since it was enacted. The law has been unsuccessful in achieving its goals and has been plagued by issues from the start. Poor website, high deductibles, expensive costs, and a penalty for not voluntarily applying for the program. The ACA also had no insurance cap, so insurance carriers could not afford to remain in the marketplace. Many withdrew or scaled back their networks. Unconditional consequences causing extreme costs to the consumer. President Trump's biggest accomplishment was removing the penalty on individuals for not purchasing marketplace insurance, allowing them to purchase the less expensive non-marketplace alternative. The industry now faces a number of challenges in the 21st century, including the rising cost of healthcare, mostly caused by all the government intervention and the unintentional consequences. We're experiencing an increased number of uninsured healthy middle-class Americans who do not qualify for a large subsidy and cannot afford the high cost of the marketplace plan. There are endless political debates at the federal, state, and local levels on this topic. Most Americans aren't aware that each state has their own state insurance regulatory agencies that allow the establishment of health insurance offerings from health insurance carriers. Each carrier must get approved from every state insurance regulatory agency they wish to sell health insurance. Very few state agencies agree with each other on what specific moving parts of the plan should look like. This all costs time and money, which we all have to pay for in the larger premiums and lack of coverage. The moving parts in a health insurance plan include monthly premium costs versus age of the person to be covered, deductibles, maximum out-of-pocket, doctor visits and how many visits allowed, specialist visits and how many of those are allowed, copay, co-insurance, and too many more to list. We'll cover health insurance terms and how to use them in the next video. For example, on how crazy states disagree with each other, say you're a healthy person and financially do not qualify for a subsidy on the ACA marketplace. These plans can be very expensive without a subsidy, and you choose to opt into an inexpensive, short-term health plan while living in Texas. You have the ability to purchase a plan up to 3 years in length. Pretty cool. Now, say you live in Illinois and have good health history, and financially you do not qualify for a subsidy on the ACA marketplace. You desire the very same plan that was offered in Texas. Nope, can't have it. Illinois only allows you to participate on the same plan for only 6 months, maximum. And you cannot renew that same carrier for 61 days, which forces you to another carrier. So, depending on what the state political leanings will dictate how flexible the state's non-ACA offerings will be, and that will cost you money. If you're one of those individuals who believe that a social medicine program is the best alternative, go visit the northern border of the country and visit the medical facilities up there. You'll see scores of Canadians opting for US healthcare on their own dime, not covered by insurance. If you want to fix healthcare in this country, there are 10 things that need to be done. 1. Ease up on HIPAA. If more people can occupy a hospital room, the costs go down. Modernize and streamline the record keeping with HIPAA so as to reduce the time and cost a provider has to provide. 2. Shorten the term of pharmaceutical patients so as to bring the price down. 3. Make foreign countries pay what the American citizens pay for prescription medicine. 4. Combine all 50 state regulatory agencies into one, which will make it easier for an insurance company to qualify and sell their newer health insurance plans. 5. Zero political contributions from any insurance carrier or any pharmaceutical company. 6. Return all hospital systems to charitable organizations and religious orders, so the medical system is not profit-driven. When financial groups purchased hospitals from the various religious orders back in the 20th century, the dollar and bottom line became more important than patients. 7. Make all required medical expenses 100% tax deductible from the first dollar, with no exclusions or limits. 8. Bring competition back to the carriers and providers within the ACA. Reward the ability to shop around for services, PPOs, instead of HMOs. 9. No more offshore manufacturing of medical goods. And 10. Give small businesses the same purchasing power as larger companies with their employee benefits. And that is the history of health insurance and healthcare in America, and the current situation we all must live in. So, if you're unhappy with your healthcare plan or insurance, you need to work with a health insurance strategist or health insurance mentor to represent at least 20 or more carriers. These professionals understand all the laws, carriers, and benefits within the current system. Work with your local, state, and federal representatives to change the current system. I hope if you learned anything from this video about the history of health insurance, then it would be that the more government involvement, the worse things have become. This is due to unintentional consequences, things that lawmakers don't think of when they're drafting a law because they rely on so-called experts to guide them. Experts who are professional lobbyists. I truly believe many of the politicians who participated had good intentions, but here we are today. I hope you enjoyed this video about the history of health insurance. We're currently in production on more videos on how you can save thousands of dollars as an educated health insurance consumer. Stay tuned, and please like, subscribe, and share with your friends.